In 2017, it became apparent that school nurses were spending way too much time chasing down orders, trying to get all of our paperwork in order so that we could give the care that these kids need to be in school. And that is when we realized that we needed to make a change. We decided to take that on as a group project and work together to create a form that we could all use that would be streamlined and standardized throughout the whole county. If we don't have the form properly filled out, they might not be able to get the medication they need to stay well and to perform well educationally. Really, that's the crux of what school nursing is. It's keeping our kids well and in school so they can get the education that they're there to get.
Now, the form is the the first and primary communication line between the school health system and the patient's physician. And it is a direct line. And being a direct connection, in the doctor's own words, reduces the chance of miscommunication.
What do we all really, really, truly need? There were a few things that one district had that the other ones didn't. And it did take a little back and forth to agree, this is the nuts and bolts. This is what we must have. And then we decided we weren't even going to have any sort of a school name on it. We were getting rid of that entirely so that medical form could actually go with a student when they transferred from one local school to the next district.
Anything we can do to make that process more efficient and more free of error. As Laura says, the chief and sole beneficiaries are the children.
We distributed our forms to all of the major local clinics in the area, and I feel like they began using it immediately. Like that next school year, we were seeing our forms coming through.
It was presented as to say, this will help school nurses care for your patients better. And that's a very persuasive argument. And it wasn't even an argument. It was presented almost as, here's what we've done to make things better for you and your patients.
I understand the peace of mind that comes with good communication between doctors, the school, and the family. And I understand where families are coming from, that they want to know that they can safely drop their child off at school, send them off to school, and go about their day and not be worrying, is their blood sugar okay? What's going to happen? Who's with them today? What happens if they have a seizure? Will they know where their medication is? All of that sort of things.
As care becomes more complex, as more kids with special needs come into the school system, staying caught up with that and keeping prevention at the forefront so that heroes aren't needed because the system didn't fail is I think, a goal that we all share.